Back in 2016, a team at UCLA, led by Professor Martin Monti, reported that they had brought a man who was in a coma back to consciousness by using an ultrasound on his brain. It was a 25-year-old man who had been in a coma following a car accident. The UCLA team sent ultrasound pulses at the frequency of 650 kilohertz to the thalamus in his brain. The thalamus in our brain controls our consciousness as well as our sleep and alertness. This is why they focused the ultrasound pulses on it, which seems to have worked. The man progressively got better, and after this, he was able to move around in less than a week after he had regained consciousness. This experiment seemed to be a success, but Professor Martin Monti warned this was just one test, and it could have been a fluke. He said that more tests would have to be done to make sure that they had not just gotten lucky and that this works consistently. Now, to fast forward to more recently, news has come out about the further tests they have done. And I am quoting from IFL Science here for more information. Quote, they have now treated 3 or more patients who had shown little or no response to stimulation, achieving encouraging progress in 2. A 56-year-old stroke survivor who had been unable to communicate for 14 months grasped a ball and dropped it on command after 2 rounds of treatment, Monti and colleagues report in the journal Brain Stimulation. He could also shake or nod his head to give the correct response to basic questions and respond to hearing a relative's name by looking at their photograph rather than an alternative. He even temporarily developed the capacity to bring a bottle to his mouth and to put a pen to paper. Unfortunately, echoing the film Awakenings and the events on which it was based, by the 3-month mark after treatment, he had regressed to his original state. A woman whose heart attack had left her showing almost no signs of consciousness for 2.5 years became able to recognize household objects after a single round of treatment. Her level of consciousness varied in follow-up assessments, but was always above her pre-treatment state. End of quote. So we can see here that some of the tests were not successful or got a small response from the patients. However, the others did work, or at least work well enough to get the patients back to consciousness, even though they were not quite the same as before the coma and had a lot of recovery to do. This should not be at all unusual. Being in a coma, especially for a long time, can cause people to forget many things, and when they come back to consciousness, they will have to relearn often basic things like how to walk or even other things most of us have learned when we were small children. Professor Martin Monti said about this, quote, any recovery typically occurs slowly over several months and more typically years, not over days and weeks as we show. End of quote. He said about the results of the study, quote, I consider this new result much more significant because these chronic patients were much less likely to recover spontaneously than the acute patient we treated in 2016. End of quote. As he said, getting the patients in the study out of a coma is a hard thing to do, considering their condition. Using other ways of getting patients like them out of a coma are seldom successful. Still, the fact That it only works some of the time or in some patients should be considered a success and is at the very least progress in the right direction. Monty has also said that he plans to make portable ultrasound devices to be used if someone loses their consciousness, but they will probably not be available that soon because they'll have to be worked on and proven to be safe and effective. This may take some time to do. This discovery has the potential to help many people who are in a bad coma and give hope to their loved ones. So thanks for watching or listening, and please subscribe to this channel if you like this content, if not already. Thank you very much.